Hospital stays in unfamiliar surroundings can be a stressful experience for children and their families. In children's hospitals, the Child Life program provides emotional guidance, self-expression activities, and coping tools appropriate to each child's developmental level. Child Life specialists are trained professionals with expertise in helping children overcome life's most challenging events. Because they understand that a child's well-being depends on the support of the family, Child Life specialists provide information, support, and guidance to parents, siblings, and other family members. They also play a vital role in educating caregivers, administrators, and the general public about the needs of children under stress. Mia Rojero is 7 years old. She was diagnosed with leukemia. When she first started to receive her treatment in El Paso Children's Hospital, she was scared of the doctors and the nurses.
Y luego ya le hicieron el catéter. Ella llora cuando le ponen la aguja.
Hi Mia, my name's Jenna. My job is to help kids out, try to make things a little bit easier in the hospital.
Mia has learned skills to cope with her illness thanks to Child Life specialists. Through playtime, Mia has learned what a catheter is, and now she accepts it as a regular part of her care.
It seems like what we're doing is very fun, warm, fuzzy. We're just playing games, but most of what I've done with Mia is just playing. But she has somebody in the hospital that she can trust and that she can kind of come to seek out. We can certainly take care of patients' medical needs with medicine and doctors and nurses, and we have to have that component to be able to make people healthy. But if we don't take care of the psychosocial, their understanding their emotional care, then we're really not doing them any good in the recovery process. Annette helps you with your flush. We're going to play with this special machine that I have. Can I show it to you?
One of the favorite pieces of equipment for kids at El Paso Children's Hospital is the Vecta Distraction Station. This multi-sensory unit uses simple distraction techniques with color, lights, and reflected images to promote feelings of well-being in a child in stressful environments. Nathan is 2 years old. He was born with hydronephrosis, a condition that causes his kidneys to swell and requires sonograms at El Paso Children's Hospital as a part of his care. Every time Nathan needed a sonogram, he would become anxious and cry. But now, thanks to the Vecta Distraction Station, Nathan is enjoying the lights and colors and is barely aware that he is having a sonogram.
Yeah, this morning, when I had to come here again, I was not looking forward to it at all because I knew he would have to have some pain today and I knew he would cry. And by having this machine and by having the movies and everything like that, it just makes me so happy that he can be happy while we're here, and it just calms my nerves so much. So when he saw that, he kept his eyes on it the entire time. I don't even think he needed me to be here in order to keep him happy.
It was exciting to see the children. They just are enamored with it, they're in awe by it, and it really does have an effect up. So the patient's calm, collected, their procedure goes a lot more smooth, and they really enjoy the experience. In pediatric healthcare, oftentimes patients can't do things that adult patients can do, so we have to sedate them in order to get the procedure done. So when we have distraction techniques or machines like the Vecta Station, it really helps us because it decreases the amount of sedations that we do.
Because surgery can be overwhelming for kids, Child Life specialists use play to prepare pediatric patients for the operating room. Donna is 7 years old. She is preparing for her second surgery, but she gets a little afraid of the mask worn by the surgeons and anesthesiologists. Thanks to some games and activities from Child Life specialist Abigail Null, Dawn was smiling and playing in no time.
When they first come in, sometimes they can be really upset or really nervous or scared about why they're here. Sometimes they don't even realize exactly why they're here, and so we can help them work through that. Prepare them for the process of surgery, what it might be like to get the anesthesia, what they might see or feel or taste. You could kind of see her strengths from that. She likes to do things with her hands. She likes to talk. She likes to tell you what things she enjoys. She was telling about wanting to visit the zoo. And as we were able to get through that a little bit, and she was able to be more comfortable with me and spend a little bit more time in the hospital setting and get more comfortable, we normalized that environment for her.
Often children will be too young to fully express what they are feeling. Art and music play a large role in the Child Life program, giving limitless means of expression and stress relief for children of any age. Assis is 17 years old. He was a patient in El Paso Children's Hospital for almost a month, receiving treatment for lupus. Thanks to Child Life's art program, he has learned how to paint and how to channel his feelings through his art.
You know, having to find something to do every day is a challenge because you're in a room.
I first met Aziz, he was much more withdrawn, and everything weighed very heavily on him. So getting him to the point where he was able to connect with creative kids, we started to see a very different patient. He was out of his room a lot more, so he's walking on the floors. He's connecting with the other patients on the floors much, much better.
The painting in the back was given to me by a 4-year-old. Her name was Luna. She's a little girl who has leukemia. She would also ride her tricycle, and every time she would pass by, she would knock on my door and she'd say hi. She saw me paint the lemur, and she told her mom that she liked it. They came and told me that she was really fascinated by it, so I decided to paint something for her. I painted her on the moon on her tricycle with an astronaut holding her IV, and I gave it to her, and she gave me this in return.
His skills that he's honing based on connecting with this therapeutic art program are really going to help him later on in life. He's learning an expressive opportunity that's going to help him cope with a medical diagnosis, a setback. It's going to help with all of the stress that he'll come across.
The teachers are nice. They're really nice, and they try and get to know you and talk to you. I used a gray background, a black table, and a purple vase, and then we use autumn colors like yellows, oranges, reds, different deep browns. And we used those colors, and the flowers came out really pretty against the gray background. I loved it. I was like, oh my God, this is amazing. So I was like, oh my God, this is amazing. There are a lot of kids here that need help. And a lot of kids don't have the funds to get help. So really, you're helping a sick kid get help.
Kids are so innocent, and they go in this. Yeah, they go in this not knowing what's going to happen. So anything that can keep them happy, even if it's just for a minute, helps the mothers and fathers and the kids so much.